Diabetes affects millions of Americans, with over 34 million diagnosed in the US alone. This condition arises when the body struggles to regulate blood sugar levels, leading to various health issues. The good news is that with early detection, lifestyle changes, and proper management, the impact of diabetes can be significantly reduced. This guide will provide valuable insights into type 2 diabetes, its causes, symptoms, and how you can take control of your health. Type 2. Diabetes is often called a lifestyle disease due to its strong link to daily habits. Unlike type 1 diabetes, where the immune system attacks insulin-producing cells, type 2 involves insulin resistance. Excess sugar in the blood can damage nerves and blood vessels, increasing the risk of serious health complications. By understanding the causes, recognizing the symptoms, and adopting a proactive approach, we can significantly reduce the risk of developing or managing this condition. To understand type 2 diabetes, we need to grasp the relationship between glucose and insulin. Glucose is the fuel for our cells, and insulin, produced by the pancreas, helps glucose enter the cells. When this process works efficiently, our blood sugar levels remain balanced. In type 2 diabetes, the pancreas may not produce enough insulin, or our cells may become resistant to its effects. This resistance is akin to the cell doors becoming rusty. The insulin key struggles to unlock them. As a result, glucose can't enter the cells as easily, leading to high blood sugar levels. Insulin resistance is a major contributor to type 2 diabetes. When cells become resistant to insulin, glucose builds up in the bloodstream, triggering the pancreas to produce more insulin. Over time, the pancreas may struggle to keep up, leading to a decline in insulin production. Factors like obesity and physical inactivity significantly contribute to insulin resistance. Excess weight, especially around the abdomen, and lack of physical activity reduce insulin sensitivity. Genetics, age, and certain medical conditions also play a role in developing insulin resistance. As insulin resistance develops, our bodies send out warning signals. Common symptoms include frequent urination, excessive thirst, increased hunger, and unexplained weight loss. High blood sugar can damage tiny blood vessels in the eyes, leading to vision problems. These symptoms arise from the damaging effects of high blood sugar on various organs. Recognizing these symptoms early can lead to timely diagnosis and treatment. Type 2. Diabetes is a complex condition with interconnected causes, often referred to as risk factors. While genetics play a role, lifestyle choices, particularly diet and exercise, are major contributors. Insulin resistance leads to a buildup of glucose in the blood, known as hyperglycemia. Addressing the underlying causes of insulin resistance is crucial in preventing and managing type 2 diabetes. Our diet and exercise habits play a pivotal role in developing insulin resistance and type 2 diabetes. A diet high in processed foods and sugary drinks contributes to weight gain, a major risk factor. Regular physical activity improves insulin sensitivity and helps with weight management. Adopting a balanced diet and engaging in regular physical activity is crucial for preventing and managing type 2 diabetes. While lifestyle factors play a significant role, genetics also contribute to an individual's susceptibility to type 2 diabetes. People with a family history of diabetes are at an increased risk. Age and certain ethnicities also increase the risk of developing the disease. Medical conditions like polycystic ovary syndrome, PCOS, and gestational diabetes can also increase the risk. However, lifestyle choices still play a crucial role in determining whether someone with a genetic predisposition will develop type 2 diabetes. Understanding these factors can help in prevention and management. Recognizing the symptoms of type 2 diabetes is crucial for early diagnosis and effective management. Common symptoms include increased thirst, frequent urination, and unexplained weight loss. High blood sugar levels cause the kidneys to work overtime, leading to dehydration and increased thirst. Despite eating normally, people with type 2 diabetes might lose weight because the body isn't using glucose properly. Fatigue is also a prevalent symptom due to cells being deprived of glucose. Blurred vision and slow-healing sores are other symptoms to watch out for. High blood sugar levels can impair the body's ability to heal and fight off infections. Pay attention to any cuts, bruises, or sores that take a long time to heal, as well as recurrent infections. Diagnosing type 2. Diabetes involves tests that measure blood glucose levels. The fasting plasma glucose (FPG) test measures blood sugar levels after fasting for at least 8 hours. The A1C test provides an average blood sugar level over the past 2 to 3 months. The oral glucose tolerance test (OGTT) involves fasting overnight and then drinking a sugary solution. In some cases, a random plasma glucose test may be used to measure blood sugar levels at any time of the day. These tests help in diagnosing diabetes and prediabetes. Early diagnosis allows for timely intervention and management. Regular screening is important, especially for those with risk factors. Early detection of type 2. Diabetes is essential for preventing complications and managing the disease effectively. When diagnosed early, individuals have a better chance of controlling blood sugar levels through lifestyle changes and medication. Regular screening is important, especially for those with risk factors. Healthcare providers recommend routine screening for adults aged 45 and older. Early intervention with lifestyle changes can prevent or delay the progression to full-blown diabetes. Understanding and recognizing the symptoms, combined with regular screenings, can significantly improve outcomes. Managing type 2. Diabetes involves lifestyle modifications, medications, and ongoing monitoring. The specific treatment plan varies depending on individual needs and the severity of the condition. Lifestyle modifications focus on achieving a healthy weight-balanced diet and regular physical activity. Significant lifestyle changes can effectively control blood sugar levels. If lifestyle changes aren't sufficient, medications may be necessary. Working closely with a healthcare provider is essential to develop a personalized plan. Lifestyle modifications are paramount in managing type 2 diabetes. These modifications revolve around diet, exercise, and weight management. Adopting a balanced diet that prioritizes nutrient-dense foods is crucial. Regular physical activity improves insulin sensitivity and helps with weight management. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week. Incorporating strength training exercises helps build muscle mass and improves insulin sensitivity. Section 3. Medications, providing additional support. While lifestyle modifications are fundamental in managing type 2 diabetes, medications may be necessary to achieve optimal blood sugar control, especially if lifestyle changes alone are insufficient. Several classes of diabetes medications are available, each working differently to lower blood sugar levels. Metformin is often the first-line medication prescribed for type 2 diabetes. It works by improving the body's sensitivity to insulin, allowing cells to utilize glucose more effectively. Other medications, such as sulfonylureas and meglitinides, stimulate the pancreas to produce more insulin. DPP-4 inhibitors and GLP-1 receptor agonists work by increasing the levels of incretin hormones, which stimulate insulin release and reduce glucagon production, a hormone that raises blood sugar levels. SGLT2 inhibitors lower blood sugar levels by preventing the kidneys from reabsorbing glucose back into the bloodstream, leading to increased glucose excretion in the urine. In some cases, insulin therapy may be necessary, especially if the pancreas is not producing enough insulin or if blood sugar levels remain very high despite other treatments. Section 4. Working with your healthcare team. Managing type 2. Diabetes effectively is an ongoing process that requires active participation and collaboration with a healthcare team. Regular checkups with a healthcare provider are essential to monitor blood sugar levels, adjust medications as needed, and address any concerns or questions. The healthcare team may include a physician, nurse educator, registered dietitian, and pharmacist, all working together to provide comprehensive care and support. Keeping blood sugar levels within the target range is crucial for preventing or delaying diabetes-related complications. Regular self-monitoring of blood glucose levels using a blood glucose meter helps track these levels and make necessary adjustments to diet, exercise, or medications as needed. Living with type 2. Diabetes requires ongoing education, self-management skills, and a proactive approach to health. It's essential to stay informed about the latest research and treatment options, as well as to develop healthy coping mechanisms to manage the emotional and psychological aspects of living with a chronic condition. Remember that managing type 2 diabetes is a marathon, not a sprint. It's about making sustainable lifestyle changes, working closely with your healthcare team, and staying positive and proactive in your approach to managing your health. Managing type 2. Diabetes effectively involves integrating healthy habits into your daily routine. It's about making sustainable changes that become second nature rather than temporary fixes. Start by setting realistic goals. Instead of aiming for drastic overhauls, focus on small, achievable steps. For instance, instead of cutting out all sugary drinks at once, start by replacing one sugary drink per day with water or unsweetened tea. Gradually increase this until you've eliminated sugary drinks entirely. This gradual approach makes it easier to stick to the changes long term. Another helpful strategy is to find an accountability partner or join a support group. Having someone to share your journey with, offer encouragement, and hold you accountable can make a significant difference. Sharing your experiences and challenges with others who understand can provide valuable support and motivation. Don't be afraid to ask for help when you need it. Lean on your healthcare team, family, and friends for support. Whether you need guidance on meal planning, help staying active, or simply someone to talk to, don't hesitate to reach out. Remember, you're not alone in this journey. One of the most impactful lifestyle changes for managing type 2 diabetes is adopting a balanced and portion-controlled diet. This doesn't mean depriving yourself of the foods you enjoy, but rather making healthier choices and being mindful of portion sizes. Start by planning your meals and snacks in advance. This helps you make healthier choices and avoid impulsive, unhealthy snacks. Focus on incorporating plenty of non-starchy vegetables, such as broccoli, spinach, cauliflower, and Brussels sprouts into your meals. These vegetables are low in carbohydrates and calories, but high in fiber, vitamins, and minerals, making them excellent choices for managing blood sugar levels. Choose lean protein sources such as fish, chicken, beans, lentils, and tofu. Protein helps you feel fuller for longer, preventing blood sugar spikes and reducing cravings. When it comes to carbohydrates, opt for complex carbohydrates such as whole grains, brown rice, quinoa, and oats, over refined carbohydrates such as white bread, white rice, and sugary cereals. Complex carbohydrates are digested more slowly, providing a steady release of energy and preventing rapid blood sugar fluctuations. Portion control is crucial for managing calorie intake and blood sugar levels. Use smaller plates, measure out your food, and be mindful of serving sizes. Regular physical activity is another cornerstone of type 2 diabetes management. It not only helps with weight management, but also improves insulin sensitivity, making your body more responsive to insulin and better able to regulate blood sugar levels. Find activities you enjoy and make them a part of your routine. It doesn't have to be strenuous workouts at the gym. Even moderate intensity activities, such as brisk walking, swimming, dancing, or gardening, can make a difference. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Stress can also impact blood sugar levels. When you're stressed, your body releases hormones that can cause your blood sugar to rise. Find healthy ways to manage stress, such as exercise, yoga, meditation, deep breathing exercises, or spending time in nature. These activities can help lower stress hormones and promote relaxation, benefiting both your mental and physical health. Navigating the complexities of type 2. Diabetes might seem daunting, but armed with knowledge and a proactive approach, it's entirely possible to live a healthy and fulfilling life. Remember, this is a journey, not a race. It's about making sustainable changes to your lifestyle, working closely with your healthcare team, and celebrating every step you take towards better health. Embrace the power you have over your well-being. By adopting healthy habits, staying informed, and seeking support when needed, you can effectively manage type 2 diabetes and reduce the risk of complications. It's about making conscious choices every day that prioritize your health and well-being, leading to a brighter and healthier future. Remember, you are capable of taking control of your health and living a full and vibrant life despite this diagnosis. This guide has provided a foundation for understanding type 2 diabetes, its causes, symptoms, and management strategies. However, it's essential to remember that every individual is different. What works for one person may not work for another. Therefore, working closely with your healthcare provider to personalize your treatment plan is crucial.